And Molly, thanks for doing this. It's been a long run with us. I love
it. All right, perfect. So we're going live. It's loading. And then we will start going. All right, perfect. So we're now streaming live. So we just want to thank everybody for doing this again. The reason we wanted to go with Brevard County, obviously it's our home, but second of all, it was like the largest school district in the country to start doing this first and really start making heart screenings something important, and saving your students' lives something even more important. So we want to, of course, start with where we started, which is Rafe Maccarone and Dr. Cosgrove. You were Rafe's pediatrician. So let's start with you. Talk a little bit about why this became such a big push, you think, in Brevard County, and something we should take precedent after Rafe passed away.
Well, I felt as though as a physician, and Rafe's physician in particular, that I missed key clues as to how I could have saved Rafe to getting to the position where, you know, he passed away. You know, in my training, we weren't trained specifically to ask special questions regarding, you know, the silent killer of athletes, which is heart disease. You know, so Rafe always had asthma symptoms, and I always chalked his asthma symptoms to him having asthma, but his shortness of breath with his physical exertion was probably not asthma. It was probably related to his cardiomyopathy, which is hypertrophic cardiomyopathy. He always complained about fatigue, and that was another symptom that, you know, of hypertrophic cardiomyopathy that is very prevalent. He wasn't a big complainer about anything else. He never fainted. He never had any swelling of the feet. He didn't have any chest pain. And that's why, you know, we didn't really go and do any further measures on him, because he wasn't a big complainer. The only thing that we ever saw in him was, you know, the breathing problems, which was the asthma. And then, you know, with the fatigue, which is, actually, his teammates always used to talk about that. They always used to talk about, come on, Rafe, catch up, catch up, catch up. And on the day that he actually had his incident, you know, he was behind everybody else, and they turned around to look and find out, okay, Rafe, you're doing your normal thing, catch up with us. And he didn't catch up. And then they saw him collapse. And then I got a call, because Rafe, not only being my patient, we went to the same church, our boys were in the same club, we did a lot of stuff together with Rafe's, all of his family. And I got a call from his aunt, said, you know, what's going on with Rafe? And I said, I don't know. What do you tell me? They said they rushed him to the hospital. I put my son, which was his teammate, in the car. We rushed over to the hospital, and I was devastated. I was absolutely devastated, saying, like, you know, I didn't know what was going on at that point. It wasn't until the next day that I knew that he had the hypertrophic cardiomyopathy. But a single little EKG, if I had done it, you know, on a patient that has asthma, that's an athlete, would have probably saved him. And I didn't know enough at that point to do that. So I actually started a project where I started doing free EKGs for all of my athletes. And I got money from the American Academy of Pediatrics, and we started screening. And then after that, all is history, because Evan came up and said, you know, what can we do with this information? So Evan's the real hero here.
Absolutely. So Evan, okay, so let's go forward. You know, Evan, Zane, they all come together. They say, you know, we got to do something. As you pointed out, this was something that kind of was going under the radar. So that was now like more than 10 years ago. Let's fast forward now, almost 13 years. And we will go to Matt Susin, the board member from District 4. So Matt, just a couple of years ago, I think it was, Evan and I think Zane went and met with you, I think at a small diner, and said, hey, this is our idea. Is this crazy? Is this something that you think we could get Brevard County behind? When you first heard this, what was your reaction?
Yeah, so thank you so much for having me on. For those of you guys that don't know Brevard County, we are the best school board in the entire state of Florida. One of my other school board members is on here, and we have the honor of being reelected tomorrow. Ms. Descovich, thanks for taking some time, just like I am on this night. These minutes right now are crucial during our election campaigns, but we are so committed to our county for what we do. And I will tell you that when I sat down with the team and heard the story of what it is, it was more of a why hasn't this happened? This is more of a why haven't we started to do this in the past? And what is it going to take to do it? We immediately I contacted some of my contacts up in Tallahassee, which are the American Heart Association, Florida Heart Association, and those groups. And you know what was really surprising to me was that they were not willing to take the lead on a lot of this, like Evan and the rest of the groups were. And so it took from us internally in Brevard to take a stand for the state and for the rest of the nation to say, you know what, it's got to start somewhere. Why wouldn't it start in the house where Rafe played, and where our county is? So we were honored enough to come forward, and Descovich and everybody else played the same exact amount of time that I did and energy into it. And we all came together as board members and supported this. And it was an amazing thing. I mean, for what I find the most insane part of this is that this is actually has to be extra work to try to get this done. This is something that should be initiated across the county. I've never heard anything negative from my other school board members across the state. When I've said we passed this policy, they said, well, how do we do that? And then there's just not enough initiative from some of the other counties to push it forward. And that's why I think some of the energy that we've put into making it a statewide mandate is one of those things that we can get over. If you guys hear my kids in the background, we're in the middle of dinner. So I threw the laptop down on the table. We're getting ready to go out. You might see a little 2-year-old run in here, a 5-year-old with his little, Captain America he's running around with. So, but anyways, what I'm getting at here is that we are honored in Brevard to be the first ones to do it. But the question is why? And then, the other piece is there's a big, our school district is a bureaucracy. And when we tried to pass this originally, there was a lot of fear. How are we going to do it with the kids? Is this going to create a situation where if some kid doesn't get flagged and something happens? And we answered all of those calls. We said, this is what we're going to do. We put it in place, and we saved, I think, what was it? Evan can give us the numbers on it, but the first year it was, Evan, you want to give that number real quick?
We're at about 20 or so now.
So 20 kids. And so you look at how many students that we lose in Brevard County every year, and then you compare it to that alone, if we didn't take care of that, could have been the largest single digit, fatal issue inside of our school district than any other. So I'm just honored to be a part of this. I'm just a soldier for them. I'm the Indian, they're the Chiefs. They just tell me, hey, we do this, and I just try to run through walls and try to make it happen. But I think that we need to make a statewide initiative and keep pushing it harder and harder, because we have saved our kids. There is no single place inside of our county where children were not able to get this taken care of, and it has saved lives. There is nothing that we did as a school board, as far as I'm concerned, and Ms. Descovich may have thought differently, but there's nothing I did that was directly connected to the health and well-being of our students. And this did it. And this was probably I'm sorry, Lane, you okay? Okay. Sorry, she's trying to talk. We talk in this family, and a big Italian family, so we're all talking. No, Matthew, now don't you start. The thing is that but anyways, we're honored to do this, and there's no barriers. We plowed through them. So anybody else that tries to stop that, just give us a ring, and I'm honored to be here. That's it. I'll take any questions. I mean, I know you want, and I could talk about this all day, but go ahead.
No, that was great. Thank you again for being here. I think it's a great piggyback going into Tina now. And you are with District 3. And so you took this on as the chair for the school board, and really took this on as a project to start pushing and get it done. I mean, and as Matt and we were just talking about, now we have over 20 kids who we have flagged. Some have had surgery to correct some heart problems that they were born with, didn't know about if it wasn't for Brevard County making this a mandated thing. So Tina, I mean, what does it look like now to look back on all that work that you guys did and see how many lives you guys have actually saved?
It's quite remarkable. As Mr. Susan said, it's such an honor for us to be part of this and to have the opportunity to make decisions that are affecting children's lives, literally one by one, saving children's lives. we make some really hard decisions on the school board. This was not a hard decision for any one of us. They came to us, Evan and Sean came to us, and all 5 of us were on board from day one. There were complications, like Mr. Susin said. I think we had to do 2 workshops that were a few hours long, and a school board meeting, a vote or 2. There were kinks that had to be worked out, but I do like how Mr. Susin just said that people can come to us now, other districts that might be interested. We've worked all those kinks out. We even workshopped for 2 hours the form that parents need to sign to fill out or to opt out, the different options. So we've got it down perfectly. I think we've got it down to a science. And if I just could add one more thing, it's that everything going on with COVID right now, I mean, they're starting to do the research and it's showing there's some long-term effects to the heart, even for people that didn't have that many symptoms. And so I think, hindsight is great right now, because I'm even more proud of the work that we've done, because we're going to be able to catch more of these issues with just a simple EKG. And one more thing, you get us the microphone, we could talk forever. We've changed physicals for children in Brevard County. You all came in and helped. We had the questions of how to help some of the students that were less fortunate and maybe didn't have the funds to get it done. But you go in any pediatrician's office now here in Brevard, and guess what they're doing? Like we even changed medicine here in Brevard for children, and so it's a remarkable accomplishment. So thank you for the opportunity.
Absolutely. All right. Thanks. Well, you guys did a lot of hard work. And so we kind of want to go into seeing how this started working firsthand. So we'll go, I guess I'm allowed to call you Linda now, Miss
Absolutely. Yes, ma'am.
I know. I grew up with her being the athletic director that kept me in line in high school. So I guess I'm allowed to call you by your first name now. But so you, were the athletic director at Satellite, and when this was all kind of happening, and I know we approached you even before we got this all mandated. And you also had a couple athletes in your house that grew up with Rafe.
Right.
What did it mean to you to see that your athletes would be taken care of?
Well, as a mom and as an athletic director, first of all, thank you for inviting me to be part of this. I'm honored. But as a mom and an athletic director, I, saw the urgency and when Rafe's incident happened, my boys both had played soccer with Rafe, and while I didn't know him, they did, and it kind of hit home for us. And so I was immediately on board. And I think we were one of the first, if not the first, high school to start the screenings. I spent time with Evan talking about how we do that process, and how we could get more kids involved, more kids tested, and we decided we'd do it through their physicals. That as athletes, they all had to have a physical. We were fortunate to have a doctor here in the neighborhood that offered physicals on Saturday for a donation. So we did it there. And just a personal little side here, that what happened was I went to the physicals that day, and as the kids came in, I took their paperwork and kind of helped out a little bit, but we had a slow spot, and Evan said, "Hey, you want to get your heart screening?" And I said, "Yeah, why not?" And I really was interested in the process, because I knew I was going to be getting the results and distributing them to parents and kids anyway, and wanted to see how the whole process went. But I have a heart defect. I didn't know it. Found out that day. I have something called a left branch bundle block that is no symptoms, but now I know. So that was kind of an eye-opener for me. But I am just so excited to see how far this has come, because I retired 2 years ago, but I'm still keeping in touch and following the progress. And I couldn't be more proud of what you guys have done and how far we've come.
Absolutely. I mean, I think you are a great example of, just how many people are affected by this, whether it's through a heart condition or, someone who knows someone who died. I mean, it's crazy. I mean, when you start putting it together, I mean, there's so many more lives that are affected by, a heart condition and things like that. And so I think that is a good leeway into going to John Wallace now. You're the commissioner of the Satellite, or is it the Satellite Beach Seahawks, or is it the South Beach Seahawks now? So with everyone, but so you knew someone, and you have a pretty good personal story about why, you thought this was so important. And just reminding you, you're on mute, so whenever you want to unmute them, but you knew someone who SCA took their lives, and you kind of saw how important this was for your athletes as well. So why don't you kind of talk about that?
Sure. So thanks for having me. So we are the Satellite Beach Seahawks. We used to be for years. We were the South Beach Youth Football and Cheer Association. We had a tough time. We were in Melbourne playing a football game, and I had some kids come up and ask me if we were from Miami. So that was the day that we had to do something about our name and have some name recognition of where Satellite Beach and where we are. But so a friend of mine, Robert Seeley, his son played football for us, and he was actually Zach was playing on the 13 and 14-year-olds, so the senior level team in youth football. It's their last couple seasons that they play before they go off and play in high school. So he's a middle school kid. And so, Robert's a friend of mine. We're both about the same age. We both have kids. He was involved in the program as a coach. I mean, he started out as, just a dad, and then he came to me and was like, hey man, I want to see if I can get out there and help coach. My son really loves your program. And so that's where the friendship started. And so, Robert goes to school one day and drops off his 13-year-old son, Zach. And the next time, he sees him is in the hospital, and they're trying to resuscitate him, and he's gone. And so, when that happened, we went through that process of how and why, and when Robert and I, talked, it was very apparent that he died from sudden cardiac arrest. And so I couldn't even tell you how the subject or the path that we took to get to where Evan and I became in contact with each other, and how this whole thing, like if I had to go back and recreate the path and the story, I probably couldn't tell you, because it all just sort of happened. It just all happened organically, that everything started to kind of come together. And the next thing I know, we're taking our youth kids, our 10 and up, and they're getting their EKGs done with who we play for. And what we did is we had it coincided with a preseason activity. So we started out, I think we did it during equipment distribution and picture day over at the Satellite Beach Civic Center. So the first one we did was at the Civic Center. So we had the old Civic Center, which is the old library side of it, and that's where the equipment was being handed out, and the jerseys and the uniforms. And then the other side, they came over to actual City Hall chambers and down the hallway where the building department is, and we just commandeered a bunch of areas, and we had a bunch of kids getting their EKGs. And so I remember it being new. I remember a bunch of parents coming up, and I'd ask them, hey man, did you get your EKG done? And they're like, no, we're good. We get that done at our doctor. And I'm like, oh yeah, you get that done at your doctor? I said, listen, you don't get that done at your doctor. That's not something that's a part of a normal physical. Oh yeah, well, why not? Well, there's a myriad of reasons why, but how about you just go in there and get it done? It's, I think we were charging like $20. And Robert was there that day. And Robert basically told me that morning, he goes, anybody that says they don't have $20, just let me know, and I'll pay for their kid to get an EKG. No kids leaving here because of $20 not to get an EKG. And then the following year, we actually took over the entire David R. Schechter Center, and we had like the whole dance area in the back. We had multiple areas set up for kids to get their EKGs, and we had it coincide with picture day that time. And so, it's just been an amazing journey to see the fact that, if you talk to Robert now, he's had a few years to grieve, and he's had a lot of tragedy in his life, even after Zach passed away, because his wife passed away like the following year. And so he's been through just a lot of grief in his life. And, his thing now is that, what he reminds me of is that he can't go back and change what happened to his son. But if you can have an impact on the kids now and the parents now, so that all of us parents don't have to experience something like that, he's like, man, I'm all for it. I'm all for making something like that happen. So, to be a part of this thing has just been an amazing journey. I've been able to, to tag along with a couple of the Who We Play For events, and Evan and I talk a lot, sort of behind the scenes, and he knows that anything he needs from me to help out, man, I'm all for it. So just amazing to be a part of this, and the fact that we're able to make these inroads of something, like Matt was saying. It's just like, there's no reason to say no. So what is we have no excuse to say we can't do something like this, because there's no reason to say no. And so I'm just so proud of the fact that the school board, made this mandatory for these kids in high school. And, I don't necessarily make it mandatory for my Seahawks kids, but I'm strongly influential in the people that are a part of our league, and everybody knows they're not leaving that event without getting one done. So, but I'm happy to be here. Thanks for inviting me.
Absolutely. I mean, the more we have coaches and athletic directors behind us, it makes it a lot easier, to get things going. So we really appreciate you, helping us and getting just the word out, but just how important this is. And I think that's now another good leeway into Matt Reed, otherwise known as Dad. Part of your job when this kind of came to Brevard Schools was, taking what does this look like, making sure the community kind of knew what was going to be happening. I mean, what did it, and you have been along with this for a very long time, along for the ride with Who We Play For. So what did it take as far as getting the community's perception and to get the community to realize how important this was?
Well, I think there were two things that we anticipated could be really big challenges, maybe three going into this. One was, in Brevard County, which is a pretty conservative place, it doesn't take a whole lot for some people who dislike something to turn it political and seize on maybe the privacy issues, or you're requiring something medical to happen. And next thing you know, they're the ones on TV framing this story, and you have a big challenge trying to pass a policy. So we wanted to get ahead of that. And so we really were proactive in getting out with framing this as a back to school story. The other part was that we, just anytime you require something that's going to cost a little bit of money, you have pockets of poverty, and you wonder whether you have to make extra efforts to get out and reach those students and their families to tell them that this is accessible, affordable, and give them the information that they need to navigate. And then the third biggest one was just simply that the decision that we were going to move forward on this happened, I believe, in the last week of school before summer happened. And as awesome as Who We Play For is, and as great as our local medical community is, it wasn't set up to do 9,000 students in 2 months. So we needed to give people a big head start and mobilize thousands of students to start and their families to get out and start getting heart screenings right away. And to frame that story as something that was positive, that there's something that is going to, take 10 minutes, cost $20, and it's going to save your students' lives. Well, we were just absolutely floored by the results once we got about 2 or 3 months into this. Not only was all of the news coverage positive, and it was heavy, but when we started looking at the numbers of how many people were showing up to get their heart screenings, how many, we looked at the number of likes and engagements in communication, and how many people were sharing this story, trying to get their own, get their friends to get their students out to get this done. It was probably one of the most engaged, heaviest communication things that happened during my time at BPS among the people that we serve. They really took the lead on this as tens of thousands of parents and thousands of students. And when we first looked at the numbers, we wanted to tell people to go out and start getting their heart screens before fall sports, because they were going to be mandatory for winter. So when we looked at, we were just hoping to have pretty good results by fall. When the first batch of numbers came back from all the schools about how many students had gotten their hearts screened and how things had gone, I think it was something like 70 or 80% at a lot of schools had already had this done. And the thing that I really found encouraging, and I think a lot of this did, was when we looked at our schools with the highest rates of poverty, Cocoa, Heritage, I think one other, the rates at which students got their hearts screened matched the rates at which students got their hearts screened at our most affluent schools, Cocoa Beach, Vieira, and one other. So that was super encouraging. And we knew we were on the right track. And by winter, we had 100% compliance with this rule, and we didn't get overwhelmed. I know that who we play for and the healthcare system had a number of things they had to figure out as they rapidly scaled up. But if I have a message from that experience, credit to our school board for passing this, is that other school boards can do this. Your community will accept it, and more so, who doesn't want to keep their child safe? I mean, it's one of the most primal instincts there is, and our community responded in a massive, really encouraging way.
Absolutely. Well, you know, what's really nice is tonight we do have the honor of having who we believe is the first kid who had surgery after we were able to find a heart condition through one of the screenings that you guys all helped us make possible in Brevard County. And so we want to introduce Brandy and Chris Cofer. And so whoever wants to talk, either Brandy or Chris, whoever wants to kind of tell the story, just talk a little about that moment when you found out that there was something that you guys would have to look over.
You can tell it.
Well, you know, we got the phone call from Sean. I'll give you your chance in a sec, bud. So Sean, actually, before Sean even called, Nemoris had called us almost for a Little League. And he was supposed to be at a scrimmage where absolutely came to see. And then Sean called us, and I just believe it. I couldn't believe it at all.
You guys cutting a little in and out. Brandy, I just want to let you know you are cutting a little in and out if we miss you. All right. Brandy, you are cutting a little in and out. If you want to try to find a place with a little bit more reception or something, we'll go back to you. Chris, why don't we go to you in the meantime? But what was this like for you? I mean, tell me, so what sports do you play, and what was it like to hear this news?
It was like crazy. Like, I didn't believe it at first. And I was like kind of scared, but also wasn't. I was just mainly nervous about missing my baseball game for the All-Stars. But yeah, and then everything went good. And then, yeah, so I was just kind of shocked when my mom said that we have to go, because I really thought that the EKG was going to be I don't know, just different and stuff like that. But then it actually saved me pretty much. And yeah.
Okay, so are you back to playing sports now? I mean,
Yeah.
How has your life changed at all? Anything that you had to do differently?
Not really, except for go for my checkups and stuff like that. But otherwise, I'm playing baseball fine and stuff like that. And I did track, and I was perfectly fine.
Wow, it sounds like you're just one heck of an athlete out there. So Brandy, if you're back, if you can hear us now, so why don't you go ahead and, so you found out that you got the call from Nemours Hospital, you found out that there was something going on. Did you guys just immediately go into surgery? And I guess, how has it changed since?
Well, actually, as soon as they called, they were telling us that he, like I said, was saying, if you could have heard me, that he couldn't do anything. Are you kidding? And they wanted us to come into their office, and they just shut us down, and they wanted to do another EKG, and I thought surely it was just, you know, some blip, some mess up. I mean, nobody thinks it's their kid. You just think you're doing a formality. And we went into the Orlando office, and then a week later he had his ablation, and a week after that he was back on the baseball field.
So he went back to playing, so he's back to a normal, healthy life. What do you say to other, I guess, Brevard County parents now that you have gone through this?
Absolutely do it. In fact, I've been sharing, you know, I've shared my whole journey on social media, just for the reason that other people can see that you never know if it's going to be your kid. And it's such a quick, inexpensive thing that, and I admit, you know, I went to the very first screening that they had, and I was, you know, I was a busy mom. Summer was here, you know, I'm a teacher, so I was like, it's my summer, I don't, you know, I'll be running all over the place. And we did it because we had to. We probably wouldn't have done it otherwise. But I also didn't know the numbers. I didn't know what the outcomes could have been. I thought it was just another box to check. And because I've shared my story, I've seen people I know get follow-ups with their kids, and nothing was wrong sometimes, and sometimes there was. But people who, they went out of their way to go to their doctor and demand an EKG because of symptoms their child had that they knew could be problematic because of me sharing Chris's story.
Absolutely. Well, we thank you for, you know, for helping us, because it, you know, testimonials are probably one of the biggest things when you're trying to convince people about something brand new. And so, you know, we need people like you to help us too. And we really thank you for doing that. And so, you know, that kind of concludes the main thing tonight. But we really want to thank all of you guys for doing this. Our last question for everyone, and we like to go in order, is we like to ask everyone, who do you play for? And so the reason we do that is because when we started Who We Play For, it was because we were playing for Rafe. But now, you know, it's expanded, and we've realized that everybody else has a motivator behind what they do, something, a reason that they're doing everything they do in their life, or the reason behind their fight. So we want to ask everybody, who do you play for? So again, we'll start with Dr. Cosgrove, and if you guys just want to go around, I'll call on you if you need to, but if you want to take over, just go ahead. So who do you play for, Dr. Cosgrove? Oh, wait, one more, sorry, you're on mute.
Sorry. First off, I always played for Rafe right from the beginning, but I also play for my sons who played soccer, for all the athletes, and for my new grandchildren.
Okay, perfect. Matt, Susan?
Thanks. I just wanted to say, originally I was friends with Sealy too. I worked insurance with him. And then also there was a kid named Josh Woods that went down in Cocoa. And Josh was one of my students that I coached for baseball, and he was in my class. So this was one of those connections that within a 12-month period really made it push for me personally. But now I think, and Ms. Descovich would probably agree, that we're here for the kids of Brevard. And if there's any opportunity that we can do for the kids of the state of Florida and nationally, I would love to be a spokesperson, but that's who I play for.
Great answer. All right, Tina, what about you?
Well, it's not fair that I have to go after Mr. Susan, because I 100% agree. I think all of us on the school board, we play for all 70,000 of Brevard Public School students and all of our student athletes in every sport.
All right, Linda?
I play for my kids. They're all grown now. They're all athletes, and my grandson, who's 10. But I also play for my community. Even though I didn't grow up here, this is home, and I spent my career in at Satellite High School and had thousands of students, and I see a lot of them from day to day. And I currently work part-time for the city of Satellite Beach as their athletic coordinator. So I play for my community and my kids.
All right, perfect. Dad?
No pressure, Molly, but I play for the next generation of athletes in our house. You know, I'm so glad that Brevard County has made heart screenings for athletes mandatory, but you may wind up living in Orlando or St. Petersburg or someplace like that. And I want to know that my grandkids, when they, take the field and they are required to go get a heart screening, that it's mandatory there too. And so that's why I'm helping who we play for in their mission. Let's take this statewide, if not nationwide.
All right, perfect. Yeah, no pressure. Thanks, Dad. All right, and then Brandy and Chris, or no, John, you're next if you want to say who you've been playing for.
Yeah, so listen, I get the pleasure of playing on the Zach Seeley football field that's located at the Satellite Beach Library Field, where 350, 400 little Seahawks get to go out there and play every week. And it's also, like Linda was saying, man, she, when she transitioned out of Satellite High School and transitioned over to the city of Satellite Beach, it's just been amazing to have. I already had amazing support, but then, when Linda got involved and really has helped us grow and flourish and provide such great opportunities for the kids. But yeah, man, I play for Zach and I play for all these little Seahawks to get out there and have a good time and know that they've had their heart screenings done, and gives me a lot of peace of mind in here that I know that, we're doing the right thing for these kids. So thanks.
Absolutely. All right. And then Brandy, now we'll go to you and Chris, if Chris has one, but Brandy, I guess now who do you play for? I know you're relatively new to this whole thing and this whole organization, but if you have a reason or why, who would it be?
Well, aside from my own children who we've gone through this, and he's the youngest of 4. So my other daughter also had her EKG. The other 2 are older, but my students, I coach cheer. I have lots of student athletes in my class, and also my community. I mean, my family's going on our 16th consecutive year of Little League. And so Rockledge is our family. And we're working, last spring, we started working on bringing it to Little League. Chris has played Century Vera football. They did several down there. And it's, each one of these kids that your kid is friends with becomes a piece of you also, as do my students. And it's for them because they don't know to speak up for themselves for it. They don't know it's a thing.
Absolutely. What about Chris? Do you have someone that you play for?
I play for my football team and my baseball team. And especially Chase, since he had one, Chase Gamardi, because he had one, but it just wasn't as serious. But yeah.
All right. Good answer. All right. Well, John's giving us a nice look at the Seahawks football practice down there. Awesome. Well, thank you guys all again for doing this. I mean, our goal again is to hopefully be able to show this to other school districts, kind of show the impact of what we've been doing, and really just kind of tell our story. So it was live on Facebook. If you guys want to share it to your pages, do whatever, like it, send it to anybody you want to. That would be great. But again, thank you guys so much for doing this. Hopefully haven't extended you past too far in dinner time, but thank you again for doing this. All right.
Thank you, Molly.
Awesome. Good to see you all. Have a good night.
Yeah.
Thank you.